What is culturally committed? We are a place where health providers can come to deepen their knowledge around the subject of cultural safety and humility, where we can have open, honest discussions with elders and mentors and learn about what culturally safe care looks and feels like to Indigenous peoples.
Welcome to the inaugural interview for Culturally Committed. If you're seeing this, and I would like to extend my gratitude to you for choosing to open your heart and expand your understanding around the topic of cultural safety and humility. I would like to acknowledge that Dan and I are joining you today from the traditional, ancestral, unceded territory of the Stz'uminus people and the Stz'uminus people. For those viewing, I ask that you take a moment to reflect on the lands that you are currently residing and consider that we are all occupying space on the territories of the First Peoples of North America. And so now I'd like to turn the tables over to Dan Elliott here for an introduction. Hi, Dan.
Thank you so much, Kim. My name is Dan Elliott. I am Stz'uminus First Nations, and I'm Scottish. And I live here in Nanaimo, British Columbia. And I work in my community now as a worker in the helping field, and it's a national Native Alcohol and Drug Prevention Treatment Program. So I help people get off to treatment, and I work with alcohol or addiction problems, and among other things. Also, I like to cook as well. You probably have tried a few of my dishes there. But I'm a father of two adult children. I've been a captain for 12 years and a commercial fisher for 25. I have two children that are amazing young people. One's studying to be a nurse at 30, and my son's going into management in Hub City Paving. And so I actually became a coach and of three different disciplines. I used to be a ski coach, a lacrosse coach for 12 years, and football for 7. And I just kind of followed my kids, and I became part of the solution as far as what I seen around helping and being involved in our kids. But through all of that, I've been actually an artist, and I've been and so I've been working on a series called The Winds of Change, and I know it's been used before, but it's around what was amazing about our culture, what was the interruption, and how can we conciliate? How can we come together in a good way?
All right, so if it's okay, we'll get into a few of the questions.
Yeah, sure. I know I branched on to some of them, but there's some that you would like to ask me. And
Yeah. Maybe to start with, I started the meeting today doing a land acknowledgement, but I think a lot of people are hearing, I think it's becoming a lot more common in society now that we're seeing people doing land acknowledgements prior to meetings. And I think people are seeing it, but maybe they don't really understand, why are we doing this, or what does it mean? I don't want it to be just a token act that people are doing before meetings. I want people to understand the significance of a land acknowledgement. So I was wondering if you could shed a bit of light onto that.
Yeah, and I think that's really come about not too many years ago. Like when I worked in the school district, that was not, and that was by not addressing that acknowledgement, it really put the world far apart between Indigenous world and Western-based world. And so what happens when we acknowledge, and I hear governments now doing it, most schools, most organizations, and it's like growing. It's growing, and the land acknowledgement is like asking permission to come ashore, in a sense. Like, I know where I'm at, and I thank you for and unceded. I actually, when I first heard it, I had to look that one up. I thought, unceded, like, yeah, there's lots of seeds out there, but unceded territory. It's like it's been in limbo, land held in trust by the government, but it's still owned in large by Indigenous people in Canada, and so it's a way to say, yeah, you know what, I actually recognize that you're here, and you're here and we're all together here by the good graces that the the Indigenous world is alive and it's well and it's here and it's not going away. It's part of our Constitution, and we can't, just eliminate it by ignoring it.
Yeah.
So the ignorance that has been kind of projected into the education system it's kind of helping that undo. So people will begin to go, oh, yeah, I need to show my respect about where I'm at, and who are the Stz'uminus people, or who are the Stz'uminus people? Where does that all go? What language do they speak? And all those things, and then they begin to add their knowledge base, and then find a way to respect where they're at. So it's a way for coming together, and that is actually a really important part of conciliation. And it's not just reconciliation, but it's the conciliation part is how we come together. And so land-based acknowledgements is like the first step in understanding who's there and what's happening with our connection to Indigenous people.
Very cool. Yeah. All right. So I wanted to touch on a little bit about, with consideration to health, like, connecting with healthcare services, talking a little bit about the impacts of residential school. And so, I think of trauma, I think of subjugation, I think of conditioning. And I think conditioning is especially something, as a clinician myself, that I think, especially oral health providers, don't put the pieces together about how in residential school, the children were conditioned, right? They were conditioned to not complain. They were conditioned to tolerate. And so from my perspective, I see the effects of that conditioning in the dental chair when people, I hear a lot of health providers saying, oh yeah, like Indigenous people are very stoic in the chair. Well, there's a reason, right? So I was wondering if we could talk a little bit about that.
So residential schools, I think there was 130. When you see a map of all the residential schools, it looks like a map of the cities of Canada. And there were some pretty horrific ones that happened, across the whole country. And there may have been some really well-meaning people in there to help. They weren't all abusers, but, when I look at the whole thing was a complete travesty and failure to Indigenous people. Taking children away. I have a granddaughter that's 7. She would have been probably 2 years now in residential school.
It's a sickening thought.
I know, and I can't imagine the anguish that the parents, grandparents, and communities would go through when all the kids are taken and going to these schools. And people think, okay, well, yeah, great, but nobody graduated from those schools. There was no graduation rates because they were learning how to do factory models and how to kind of sow, farm, and do all these kind of domestic things that they thought were helpful. But so my grandmother went through Cooper Island in the Gulf Islands here. She went through Cooper Island Residential School, and she never spoke of it. And I often wondered why. And so working in the field that I am, I understand that there are no words. You can't describe the pain. So it's like a dominoes, this domino effect of one generation, and this, so there's actually many generations going through these schools. It wasn't just a one-time event. Some of them were going through their whole, 6 years old to 15 or 14. So all those years suffering abuses. So it allowed generations to domino. And so the pain, the trauma, the silence, the fear has a domino effect culturally. And then it became part of the fiber of our Indigenous communities to have a certain amounts of fear around doctors, around schools. When I worked in the schools, it was, these guys won't come to the parent-teacher meetings. Well, yeah, they're afraid to come through the doors.
Yeah.
So I used to go down and kind of, help communicate that to the parents.
Mhm.
So there's this. So now we're in our seventh and eighth generations from when that was happening, and then they talk about the seven generations ending some of that stuff, and we see our young warriors, our young people that are just like champions. And I know for myself, I'm proud of the fact that I interrupted violence and alcohol and drinking, and my kids never seen me drunk or violent. And so that's changing the next seven generations in my family alone.
Yeah.
So part of this whole thing is we're in a place now where if we can help nurture those seven generations and and help all the future ones that are coming, and so the safety will need to be less and less. But I think it's really important for not just people to have understanding of what happened, but also for to have people begin to gravitate, indigenous people gravitate toward where it's safe. And if they see something that, oh, this is a safe organization, it's a safe way to for me to branch out, whether it's medical or dental or whatever that is,
Mhm.
then that's a huge step in conciliation. So you're taking a big step in reconciliation by conciliating this piece. So I say hi to you, Kim.
Thank you,
Yeah.
Dan. I appreciate that.
So our people, our indigenous people, had no lawyers, no doctors, no judges, no government, no police, nobody. They were all part of that system that was systemic racist system. So they had nowhere to turn. So their spirituality had to go into the woods, if you will, or had to disappear. So a lot of our elders are. I'm not going to tell you, and I'm not going to show you what I know. So they're careful about how they respond to you. So when you're talking with elders and indigenous people, instead of thinking about how you're going to respond, um, originally our language was, "I will say something to you, Kim, and you can take a moment to think about it, and then you can respond." And that's so people think, "Oh my gosh, these guys aren't talking, these elders aren't talking," and but they're thinking of how they respond, and it could be spiritual, emotional, mental, physical. They run some of their thoughts through all those pieces,
Right.
and so sometimes it takes longer, and that's okay, but it's more powerful.
Mhm.
It's a more powerful response.
Yeah.
And I do think that we need to get back to some of that, where I listen to hear you, not listen to respond.
Yeah. Absolutely.
Yeah, that's a big one.
That's
Yeah.
fantastic. And it's something that I
Mm.
think in my culture, it feels like those moments of silence can feel very uncomfortable.
Hmm.
We're just like rushing to fill the space with words. So really like learning to just sit back and let those moments hang in the air and really contemplate when somebody's trying to tell you and how
Hmm.
you want to respond to them. I think that's so valuable.
For sure. And as a counselor, I know that like 80% of our language is through our body language. So when you see the whole person, it might be even different than what they're saying. So it's really a powerful way just to allow the space for the person to connect with you. And
Mhm.
that's going to be a key piece to develop trust and then respect. And then all those things follow
Mhm.
when those doors are opened.
Yeah, and well, it makes me think of one of the concerns I have actually around cultural safety and humility, and the fact that I hear a lot of patients that will come talk to me about experiences they've had in a medical setting
Hmm.
where they felt like it wasn't safe, but
Hmm.
it wasn't overt unsafety or disrespect. It was more centered around how somebody said something or what their body language looked like or how a question was asked on a form. And so they don't really feel like they would never escalate it or take it beyond that
Hmm.
encounter because I think it maybe doesn't feel like it's like they kind of devalue their feelings, right? Or they think it's
Right.
not of significant importance.
Yeah.
And so like I think that's one of the main reasons that I am starting this, is because I think, you know, there's so much to be learned from these small interactions, simple things that we can be doing to improve cultural
Mhm.
safety, and how it
Yeah.
sometimes is the smallest things that make a difference.
Yeah, you're absolutely right. And when we recognize those and we practice those, I know even if I'm counseling, like I'll adjust my chair to make sure I'm at eye level. I'm not above talking or looking down.
Mm-hmm.
And so all those little nuances are, it's because we're really we have a lot of people that are jilted for generations. They're jaded and jilted, and so they're quick to respond, or they're quick to dismiss something.
Mm-hmm.
And so when they feel that little tiny I'm heard, I'm seen, I'm respected, wow, okay, well, I'm going to tell you. And then sometimes you can't shut them up. I'm just they're just like wow, because they feel safe. and
Yeah.
and really, that's for me what you're going to be doing through this. I think that's a conduit, a vehicle for that to happen.
Yeah. I
And
hope
then
so.
so I'm hopeful for that.
Yeah.
So
You
yeah.
mentioned about in an appointment how you try to make sure your chair is at level. Is there
Hmm.
anything else that clinicians can be doing to increase the comfort of patients when they are coming in with, you know, fears or histories of medical trauma, that we can be doing to make them more comfortable?
Yeah, I think even just acknowledging where they're at, like instead of having a client sit in a corner somewhere, have them close to a door, so that feeling of I can get out and run if I need to, that
Mhm.
fight or flight mechanism kind of subsides a bit. If the space is like they feel safe, like they can leave if they need to, and then those open communications, and sometimes it takes a little while, and I know doctor visits are like 10 minutes and no more, or and they're typing, they're not looking at you.
Yeah.
That's when we used to, back in the old days when we weren't on the phone to the doctors.
Yeah. Before we zoomed our doctor's appointment.
I know it's just crazy, but so there was some, and I get it, because it's all about billing and it's money, and if you slow that down it means more money. But I know lots, even when I worked with elders a few years ago in Nanaimo Family Life, uh, they felt like society was becoming insensitive to them as human beings, and I think Indigenous people sense that.
Yeah.
But if I turn my chair and I'm looking at you, and I see the whole person, there's some powerful, we say, medicine in that. There's powerful connections that happen, and that's where trust is formed in those spaces. But if I'm forever looking away and I'm hearing you, but I'm typing, and it's like, doc, I'm over here, like, I got a whole body here too, and or whatever that is, and so it's around making those connections. And then I know our dental things that happen in Stz'uminus Health, people feel that, just so you know.
That's nice.
But I hear you. I mean, I hear laughter, and so it's you eliminate some of those fears, and that's something that you can develop a skill around as a professional.
Mhm.
How am I going to help reduce fears for that client?
Mhm.
And so then you can kind of begin to have a relationship, professional in a
Mhm.
way, and yeah,
Yeah.
it's good. And I think it's an opportunity to pull those connections together as nations too.
Mhm.
That'll help allow the safety around professionalism and Indigenous people coming to access those
Mhm.
parts. Yeah.
How about as far as pre-appointment? I often wonder about, is there a way, or would it be appropriate in the screening process before somebody comes in to ask them if they have any anxieties around coming in for an appointment, or do you think that's appropriate?
Oh, I think it's a really powerful one because there is, anxiousness around historically around coming into any medical appointment.
Yeah. I
Yeah.
know one of the things that I've done in my practice is trying to, because I am working in, a Hulkaminam region, is trying to learn some, basic language,
Mhm.
greetings and how to say tooth and all those little things. And I'm finding
Yeah.
that that's sometimes a way that I'm engaging with the elders. It's when they ask me who I am, I say I'm the Yenis lady. And it's like, oh, wait a second.
Okay. How do you know that?
The white lady is speaking Hulkaminam. So I'm just wondering
Yeah.
about, like, do you think that would be a good thing for clinicians in the area to be trying to do, is
Oh, for
speak
sure.
pieces of the
Simple
language?
simple greetings, and is a I show my respect to you by knowing a couple of words. And that could be a real door opener too. Like, okay, you know what? I feel safe here.
Yeah. I wanted to talk a little bit about it's a problem that I keep seeing, like complaints coming in from people that come to share with me, and it's around informed consent. And so oftentimes I'm hearing that people are seeking care at dental offices. And then they say that, like, the dentist just does the work. They don't really talk them through it. They
Mm.
feel like they're not a part of the conversation. It's not explained to their understanding. But then on the flip side of that, I'm also seeing people that are coming to see me, and I am explaining. But then when they come back the next time, or even if at the end of the explanation I say, "Do you understand what I said?" Oftentimes they're like, "I'm actually not sure that I did." And so I'm just wondering about how trauma might play into how people are receiving information, if it's
Yeah.
kind of impacting their ability to understand, or if they're just saying yes when they, as a like an automatic response to kind of, because they feel like they're under pressure. What do you think? What are your thoughts around that?
Well, I think you're touching on a very important piece because they want to get the heck out of there. They want to get out, and so all of those intergenerational issues around abuses and traumas and severe systemic racism, and maybe they don't understand what happened, and that's just when you're triggered or you're in trauma, you don't hear the peripheral stuff. It's
Yes.
hard to reason. You're in fight, flight, or freeze, and you're freezing in a dental chair,
Yeah.
so to
In
speak,
more ways than one.
in more ways than one. And so, yeah, so it is important, and that's a great way to reiterate. It's like, hey, do you know what we just did here? We you went for white filling instead of an amalgam or whatever
Yeah.
that is, and so they're going, oh, okay, yeah, so I'm not going to have any more pain, or oh, I need to go to get a root canal, or what is that going to look like?
Yeah.
So now you have a chance to take that down so that they can hear, and
Yeah.
that's the process, and that's the skill that will come out of having this kind of collective body, because it is a skill. You
Mhm.
don't just develop that automatically. You need to kind of work through that, be sensitive to it,
I feel like
and
it.
yeah. So wherever people are at, be okay with it. It's like you're probably tired of explaining so simply what's happening, but that's what people need to hear.
It's important.
Yeah.
You
And
talked a little bit about the trauma response, fight, flight, or freeze, and
yeah.
it made me reflect on a time that a patient came in to see me, and she
Mhm.
was very, I guess, kind of confrontational, a bit aggressive. It was a young woman. She was probably about 17. And I immediately could feel my back going up. Like, I was aware that I was like, you know,
Yeah.
I could feel my back going up a little bit. And then, taking a moment to, like, take a deep breath and recognize that it probably doesn't have anything to do with me, right? She's probably going through something else. And so when I did put the walls down and just say to her, "Are you okay? Like, is something going on?" That's when, she just kind of, her walls came down, and she just started sharing this horrific traumatic event that she'd been going through in the
Mm.
past couple, in the days before. And so I was wondering if we might talk a little bit about, what can a trauma response look like in the dental chair? You know, sometimes I think providers see people that might seem angry or indifferent or like they just don't
Mhm.
care. And so how do we identify that, and how can we, how can we become better care providers when we're confronted with situations that do feel aggressive or that can get our back?
And I think the acknowledgement is one of the diffusers, and just recognize for yourself as a professional that you're feeling anxious because you know they're feeling anxious, and acknowledge that.
Yeah.
Say, wow, okay, what's happening here for you? And so that's like, yes, that's what I'm feeling. Thank you.
That actually kind of brings me to maybe my final question. It's talking about, I'm trying to compile resources that people can use
Mm.
or investigate to deepen their cultural safety and humility. And so that's part of what this interview is going to be about. But I'm also linking
Mhm.
in the the Truth and Reconciliation Commission calls to action.
Mhm.
I've included links to the SANYAS cultural safety training that's put on by the provincial government, and also the FNHA It Starts With Me campaign. And I was wondering if your exhibit sounds like a really great learning opportunity for people. Can you think of
Mhm.
any other ways that people can learn to deepen their cultural safety and humility? Because I think the people that are wanting to learn are seeking ways to learn. So,
Mhm.
any suggestions?
Well, I think there's some people that don't even know that there's 94 recommendations. And can you name one of them? And some people are like, I don't know. So it's just about even reading that. And then we have a final report that's out too on the truth and reconciliation. And, the truth part is about acknowledging what's really gone on. And I had a professor ask me, she says, well, what do you think about reconciliation? And she said, who needs to reconcile? And I said, oh, that's a good question. And yes, we need to communicate together, but the reconciling is like, hey, we came into your land, your territory, we messed up, we tried to eliminate you, we tried to do all these things to take, assimilate you, and man, it was bad and it was wrong, and so the whole piece around reconciliation really comes from the Western kind of viewpoint of Indigenous, and it's hard to look differently because that's our existence. I am a part of that existence.
Well, thanks for sharing that. It's pretty amazing.
Okay, thank you. Anyway, yeah, that's just my. I got piles of scraps of paper I write, and I have ideas, and I was like, oh my God, someday maybe I'll have to put some of that stuff down. But
Good.
yeah. Anyway, I really I say Heichka Siam Eichsleni. Thank you for this wonderful woman here, that strong woman that's coming forward with this wonderful idea, and I'm honored deeply to be connected to this. Probably going to cut half of this out, but it's wonderful anyway.
It was still nice talking to you, and I really have to Heichka to you because I really value your mentorship and guidance. It is making me a better clinician. So I appreciate it very much. So Heichka to
Oh, oh, Siam
you.
Heichka, thank you.
All right.
If you are a health provider who wants to deepen your understanding around the subject of cultural safety and humility, and you have questions, or if you are an Indigenous person who would like to contribute knowledge and guidance to the conversation, please reach out to info@culturallycommitted.com.